Welcome to True Health Tuesday, and the truth will set you free. Okay, we're trying this format again for this tonight, because what's interesting when we're talking about autoimmune diseases all throughout August, we're going to do about a 10 to 15 minute talk on some stuff that's pissing me off, and then we'll go in and answer questions through YouTube, through Facebook, and through everybody here. But I wanted to show you a couple of things that's driving me crazy, because people are coming in all the time saying, Doc, I got this high blood pressure. My naturopath, she's really, really good. She just gave me something for thyroid. Well, really, what's busted? Were you shot with a pistol in your thyroid? When we look at stress, okay, it's not just our bodies that are stressed out. We got to look back at our planet. Because right now, if everybody thinks that everything is going along just fine, okay, if you think that this world is just hunky-dory, anyone go camping in the 70s? Yeah, so did I. Did you have to bring your own firewood or your own water? Water filtration? No, you dipped it in the stream. Okay, we can't do that anymore. Okay, the air is polluted, the water's polluted. Anyone want to go fishing off of West Florida? All you need is a shovel. Okay, billions of fish are being destroyed. So we're doing something. And I like this quote here. We didn't inherit the earth from our ancestors, we borrowed it from our children. So when we're talking about the health of our body, the health of the planet is also primary importance, because this is the only place we got to live. It's the body, this is the only body you got left to live. I mean, we're not going to get another one. Now, I've used this slide before on a few talks, but what's frustrating about it, these are children with bowel disorders, ulcerative colitis, Crohn's disease. And this is totally unique to the world. This has never been happening, where the infants and children, our future, are being destroyed. Now, this has to do with the toxic food, the toxic medications, the 72 doses of 17 different vaccines. And yes, it is true that American children have about double, if not a little bit more, depending on the country, the rest of the world. So why are our kids so sick? We're the sickest animal species on the planet. Could it be that we're doing something not right? Do we have the healthiest planet, or are we in deep trouble? How's the economy? Doing great? Got some free tickets to Venezuela. Anybody want to go? This is a big deal. South America, there's a recession or a depression, a massive shift of economic challenges. So we have another 3 to 4 years where the planet is going to be a great challenge. But it's only going to be 3 to 4 years, because there are cycles, and we're going to be explaining what those cycles are. But right now, when we talk about stress, if you start looking at this, there's a huge amount of stressors. You're stressed about what's the label that they use for people that have a different political agenda than yours? Oh, terrorists, that's right, okay. Okay, they're not just saying, hey, let's blow up this stuff because we just want to create terror. They have a different motivation. Well, this right here is one of the things that's driving me crazy. Type 2 diabetes is curable in about 30 to 45 days, as long as you don't take the drugs that destroy, that lower blood sugar, but insulin remains high. And this patient, 45 years old, she came in today, and this is the chart on the right with the red and the yellow and the green. This is the sympathetic side is on the left, the parasympathetic side is on the right. We have this automatic nervous system. One part keeps you alive under stress, that's the sympathetic, fight or flight. The other part regenerates tissue, that's the parasympathetic. So we need a balance of these. If you are in the stress side like she is, she's that little white dot way down on the left-hand side of that red chart, extremely stressed. Now, the numbers on the chart are on the left-hand side, and she has a 46 for this, and 95 or above is normal. And so this gal is incredibly stressed. So if you have physical, chemical, or emotional stress, your body responds like you're being chased by a tiger. So here, her heart rate's elevated, her blood pressure's elevated, her blood sugar's elevated, the adrenal glands are firing off, so the thyroid's going to appear low. Anybody think, how does she sleep at night? Real good, poor, great energy, fatigue? Okay, now this gal, she's got you know, a naturopath, you know, and sometimes they'll call their practitioners a holistic medical doctor. He only prescribes the lowest dose. The other doc wanted to do 3 bypasses. This guy only wanted to do 1. So you start looking at this and you go, well, wait a second. Is that like you go in there and you get the natural Twinkie? You know, it's actually vegan. So no, that's stupid. Okay, but they're doing an allopathic approach. You know, your thyroid's low. We're not going to look at your physical, chemical, or emotional stress load. We're just going to give you this herb that's going to help the thyroid. A thyroid support. Oh, you can't sleep at all, no problem. I'm not going to look at the physical, chemical, or emotional stress. We're going to give you this adrenal support. Doc, what do I do for B12? You know, I don't have any. You know, I'm exhausted. Okay. Well, you know, we could build up your gut bacteria and look at your physical, chemical, or emotional stress, or just give you the supplement. Which one's easier? You know what I mean? And so there's not a lot of thought there. This guy, or gal, 83 years old. I mean, low back pain, numb hands, anxiety, fatigue, high blood pressure. At 83, if she was in America, she actually came from Israel, but at 83, she would be taking an average of 12 prescriptions. Does that make her body healthier? No, because high blood pressure doesn't exist. It's not a disease entity. It's an adaptive physiologic response. Okay, thyroids, unless you've been blasted by radiation, okay, or they're not going to malfunction unless there's some environmental toxin which we're exposed to. Anxiety, stress, and fatigue, we're an animal species. If you had a group of deers that had anxiety, stress, and fatigue, you know, you would say, hey, look, get out of that toxic, deficient, dangerous environment. Do you know what I mean? So a lot of these diseases aren't really there. And then you look at this kind of article that says, regardless of the etiology, regardless of the cause, that all diseases, all chronic illnesses or injuries have an autonomic dysfunction. I don't think it's a dysfunction, it's an autonomic adaptation. That means if you have physical, chemical, or emotional stress, your body is responding correctly. Okay, if you have high blood pressure, if you have high cholesterol, if you have type 2 diabetes, if you have a poor functioning bowel, if you have adrenal fatigue, if you have anxiety or stress, I'm telling you right now, your body is responding correctly giving that environment. If you try and take supplements without going after the cause, or drugs without going the cause, you will not thrive in this world. You will get sicker. Okay, does any questions about that? Okay, good. Because I got an idea. If you look at the body like you look at our planet, you know, a few years ago we could do a lot more stuff. You could run outside, you could drink out of the streams, you could go fishing without limits. Okay, because we're living in an infinite existence in a finite world. Granted, all the stuff that we were doing back then is causing some of the problems now. So now we have to be responsible for our planet. We've got to be responsible for our bodies. So if we develop physical, chemical, or emotional stress, if we develop high blood pressure, diabetes, digestive disorders, anxiety, stress, poor sleep patterns, you know, inconsistent bowel movements, interrupted in fertility. If you develop these things, you don't go in and say, what drug can I have? Please fix me. I've got 20 years of toxicity and deficiency. We got an 18-year-old kid coming in here with autism. He's got 2 handlers. Do you understand that within 8 more years, 1 in 2 kids will have autism? Do you understand that if you have nonverbal autistic, and these kids, it started in the early 90s where it just started to get exponential. But now, in 20 more years, we're going to have 40-year-old nonverbal autistic people rummaging around through the trash can because their parents are gone and there's no infrastructure to take care of them. Think zombie apocalypse. Okay, this is a big deal. Okay? Now, I'm going to answer questions for the next 50 minutes. Any questions from, we got YouTube, Facebook, and everybody. Any questions? Yes, sir.
How we going to stop Senator Penn, from the deadly bill?
Well, hold on one second. We got a wonderful girl. Her name's Vanna. No, not Vanna. Cassandra. She's got a microphone. Go ahead.
Here's the question is, how we're going to stop in California Senator Penn from his campaign to curtail dissenting news about vaccination? How we're going to stop him from, basically reverting what has been approved already for, mandatory vaccination for kids? How are we
Okay.
going to do it?
Okay. Well, for one, it's not Senator Pan.
Okay.
Senator Pan is he's getting a huge amount of campaign contributions so that he can get reelected. Okay? And he's probably making some good money on the side too, suggesting these therapies that he was taught were safe and effective. Now, he is absolutely blind to the negative effects and blind to the ethics and morals because me and Senator Pan have different ideas. I think that people are responsible for themselves and they should be responsible for what goes in their body. And I think if parents are responsible enough to give birth and bring the kids into this world, that they should be responsible for choosing the medical therapies. I think that a government that chooses to do to your body against your will or forces you for employment or education to have a forced medical procedure without informed consent, with no liability for the company that's injecting it, and then it's Wild West. I think that it's not Senator Pan. I think it's tyranny. We have a government that has gone bonkers, and the reason it's gone bonkers or crazy or it's taking the rights away from the citizen is because we're in the chaos phase of our government. We're seeing the end of this. This is not free speech, okay? They're wiping out a number of sites like what we do because we're saying, look, pick up the pitchforks, say no, don't get your annual flu shot, okay? Take vitamin C. There's a lot of different healthier alternatives. And if you think that the world is safe and healthy and our population is safe and healthy, by God, that fluoride in the water is really working. Jesus, we should have fluoride in the water. We should have a lot of stuff because obviously the frontal lobe, which is involved in impulse control, isn't working. But if you look around, when you start seeing 9-year-old kids in strollers with helmets, and that becomes unusual to you, then you're in the real world. But if you accept that, I heard there was an autistic kid on Sesame Street because it's so common. So this is not Senator Pan. He's a figurehead. And really, we have different values. I think that people should be able to choose for themselves medical procedures and also choose for their families and communities. If you really want to get down to it, the poor guy isn't based in science at all. He's a politician. If he was based in science, he would say, look, let's do a double-blind placebo-controlled trial study of 200,000 kids. 100,000 get the 17 doses of 17 different vaccines and we follow them for 20 years. Then we get 100,000 people raised with no vaccines, but let's screw it up a bit. Let's give them organic plant-based diet, healthy lifestyles, vitamins, nutrition, and not feed them any fast food. Okay, then let's take a third group and raise them with the standard American diet. Okay, follow them for 20 years. Anybody? Got an idea? Which group do you think will turn out okay? You know what I mean? It's insane since vaccines never had a long-term double-blind placebo-controlled trial study. But there are groups that have unvaccinated and groups that are vaccinated. It's pretty darn clear at what triggering a Th2 response and injecting foreign objects or foreign items, foreign proteins, foreign adjuvants into your system, what this does to your immune system response. We're seeing a massive rise in inflammatory diseases. Forget about bowel disorders, asthma, breathing problems. What about inflammatory brain disorders? A good way to reduce the autistic epidemic is to start to rename it. In 1998, they came up with PANDA syndrome, okay? The pediatric autoimmune neurodegenerative condition triggered by, I think, streptococcus. Okay, I think that's what pandas mean. But it was developed, but what they're doing, they're seeing groups of sick kids. And if everybody in this audience had um, self-stimming behavior, flailing of the arms, loss of eye contact, okay, bowel disorders. Would they all have it to the same extent? No, no, but you know, the ones that would, they'd be autistic. Then no, you don't have it bad enough to be the autistic spectrum. So then let's put you in the panda thing, which is a totally separate disease entity. Does anybody actually think that? No, you're really sick in this category. You're just mildly sick, so we're going to put you here. Oh, you got the same stuff, but you got skin rashes. Okay, we're going to call it Sjogren's disease. Oh, you got something else. You know what I mean? It's just a very, very sick population where bodies are not adapting to the environment the way they were. So the entire political structure means our government is funded by the largest industry in the world, which is the pharmaceutical industry. So the average person in America is taking 12 different prescription drugs, okay, and if you're not up on the 13 adult vaccines, you got to get with the program, because pretty soon, I mean, if what's Bill's wife? Oh, Hillary? Okay, if she got in, we were going to have the Healthy People 2020, where you would have forced adult vaccines. So the entire force, I'm telling you right now, I wouldn't say, look, everybody in America has to have 5,000 milligrams of vitamin C a day or you lose your citizenship. You know, you have to have a liter of fresh filtered water every day in order to maintain your ability to drive a car. No, that's tyrannical. Okay, where I'm forcing people, even though I have a belief system that drinking water is good for you. And I've got tons of data points to prove that. And I've got tons of data points to prove that the vaccines are not good for you. So no, you know, it's not pan. This is a society that we've let run amok, and it's controlled by the corporations. And the only way that we can do it is to say no and educate people. Wait, do we have a question from YouTube? Facebook?
I have a lot of questions from Facebook. We can do, what's a natural way to dissolve kidney stones?
Oh, apple juice. Natural way to dissolve kidney stones, raw, organic, unfiltered apple juice. But also look at what formed them. What formed them is dehydration. Okay, dehydration and toxins in the environment. Typically, people will be asked to do half a gallon or to a gallon of organic unfiltered apple juice for about 3 days. But just drinking water, your body will take care of them. She's got the microphone. Are you afraid of the dog?
I just wanted to say, what about bladder stones?
What about bladder stones? Those are going to be the kidney stones that come down. Dehydration, same thing. The malic acid in it will start to dissolve them. But what did it come from? It came from a dehydrated, toxic, deficient environment. Okay, because you got to look at the functional unit of the kidney is the nephron, and that baby filters out so many different things, but it can be damaged by the environment that we're in. I mean, you're talking, there's so many things in food products that blow holes in the intestinal tract and can actually damage that kidney. So look at the causes of it, not what do I do for this? Okay, because once you know what caused it, then by reversing those lifestyle factors, then you're not going to have them. They're just going to start to go away.
So can I expound on that just a little bit?
Huh?
I just want to say, my daughter had her bladder reconstructed when she was 3. And so she had a bladder augmentation where they took part of her intestines and enlarged her bladder. So she casts all the time, ever since she's been 3. She's now 37. She can't, because when you cath, it's like you can't get out all of the urine completely, like a teapot that ends up with lime deposit at the bottom of it. So she develops bladder stones, and she's had many lithotripsies.
Okay, when you're looking at that specific case, she had a bladder surgery at 3. Okay, so then let's look at her environment. Does she have bunion formation?
No.
Okay, I would be suspect of that, only because of the unstable pelvis. How does she sleep throughout the night? So look at the stress factors that are there. Because if they built the bladder and the bladder doesn't have that detrusor muscle to squeeze it out, then absolutely she's going to need to put a catheter in there. Because you got a muscle around a normal form bladder and you got to squeeze it out. So now if there was some type of trauma, and it could have been an impact trauma or congenital anomaly, then they got to build up something that might not function correctly.
Well, what they said, it was a trabeculated bladder, so it was constantly flexing all the time, which was causing the urine to go up the ureters into the kidney.
Okay.
She was developing kidney damage.
So remember, you might want to hold this up because otherwise I'm going to have to repeat this because this is being recorded live on Facebook and YouTube. And if you'd like to talk about this, so I mean, we can't go back in time, but you got to figure bladders don't just all of a sudden spasm out. Okay, they don't do that. You know, your arm just isn't going to flail around.
So this is like from the time she was like 6 months old.
Okay. Bladders at 6 months old will not do that. Okay? There was something that caused it. Since the nervous system controls that detrusor muscle that squeezes that bladder out, I would look at neurotoxins that she was exposed to and the structure of the pelvis itself to see if there was some type of autonomic or neurotoxic effect that was causing it. Since we can't go back in time because she's 37 years old now, then you got to look at the best thing that you can, because if they replace part of that bladder with a part of the intestinal tract to make it larger, but it can't contract, then a catheter is going to be the best option. But the original problem that caused it still hasn't been uncovered. It's not a bladder that just kind of went wacko. Human beings don't do that. And surgeons typically aren't going to look at the autonomic response or the other contributing factors. Does that make sense? It's kind of like when the vaccine they got a vaccine for diarrhea. Okay, now the roto vaccine. Okay, well the first few kids that got that had massive bowel intussusception, and I think it killed around 350 kids. Okay, so but it's just an experiment. So mellow out. I know, it seems insane because if somebody has diarrhea, it's typically from poisonous water or poisonous food, and correcting the infrastructure of that would probably be better. So to find out what she had when she was 6 months old or before that, or what you were exposed to that caused that malformation or that abnormal response, that would be the better source. But if her bladder is still bad, I mean, what if you were shot in the gut? Okay, and you're missing a bladder. What if you had, some of the traumas? The same thing, same response is going to be look at her physical, chemical, and emotional stressors now. Because if she's had this incident, where she's got to catheterize herself for her whole life, that's going to have an emotional component to it, and it's going to have a stress component. So if she's in a sympathetic dominant state from having that surgery and that problem, that challenge that she has with, it can negatively affect her. So look at all three of her stressors and get her as healthy as possible. Does that make sense? Mm-hmm. Good. Yes, sir.
Thank you. Do you have any recommendations for natural remedies for persistent rashes?
Yeah, find the cause. Next. I just went through that whole thing to go over find the cause. Okay. Persistent rashes. Okay. Does anyone in here think a rash is a skin disorder? I'm going to throw something at you. Okay. Is a rash a clue to a problem? Yes. Okay, absolutely. So when you look at it, studies back in the 40s found out that skin rashes, and we're talking eczema, psoriasis, all of that was from low stomach acid. So then you got to look at it, well, wait a second, if it's low stomach acid, what causes it? The fight or flight, autonomic dysfunction? Possibly. Could it be environmental toxins? Absolutely. Could it be different stuff they put on the skin? Knowing that the toxic deficient environment. So it's not really natural remedies. So now let's say you got somebody only healthy soaps. They eat nothing but an organic plant-based diet. They know that the skin rashes has to do with the gut health because the skin is kind of like your intestines turns outward. Okay, so this could be candida, fungal infection, yeast. Okay, the little hyphae in there. So you're looking at a leaky gut possibly. And then what kind of antibiotics were they using within the last 20 years? So then you start looking at what's the environment like. So if they're an organic, plant-based, healthy diet, and this is going to sound weird, do they have bunions on their toes? Because if they do, there could possibly be an unstable pelvis. Do they get up at night to pee? Okay, that means the sleep is interrupted. That means they're already in a hypersympathetic dominant state or a hyperexcitable state. So if they're in a hyperexcitable state or a sympathetic dominant state, that means blood supply to the gut's going to be shut down and they're already going to have low stomach acid. So it's going to sound weird, but you got to look at the physical stressors. Okay, there could be an unstable pelvis or pressure on the nervous system. There could be an old whiplash trauma. Then you got to look at the chemical stressors. Antibiotic use in the past, drugs in the past, drugs in the food. Are they 100% organic plant-based diet? Okay, good. Then how long? Are they doing fermented foods to repopulate that gut? Okay, beautiful. Then you look at the physical stressors. You got to look at the structure, look at the chemical stressors, then you look at the emotional stressors. Okay, because anyone with long-term issues, particularly skin issues, you're looking at a very big emotional component. Okay, so you fix all three of those and the body starts recovering. It's like my wife has got really, really bad vitiligo. And I mean, her whole forehead was all white. Now it's dark up to here and now she's got little white eyebrows now. But that was for 20 years of doing steroids and antibiotics and pain relievers for ulcerative colitis. We fixed that and got her body working right. But it's taken about 2 years to you're seeing this vitiligo progress. And then I'm saying, hon, we're working on the physical, chemical, emotional stress. I can't find you a better husband. I'm all you got. This is it. There's certain concessions I would make. Pierce Brosnan or, Sean Connery were available. I'd say they're better choices. Sean Connery, what is he, 85 now, 86? He'd still be better than me. Okay, but so you got those parameters, but, and so now we're starting to see it recede. And she's blown away because it's like, oh my God, this really does work. So you find those three and you're going to find the solution.
Yeah. So collaborate on his question. It is me actually who, I don't know what to do because I have my own detox retreat for 12 years. I worked with Charlotte Gerson for 6 months. So I give him coffee enemas, I pickled, we have our garden, we have Norwalk juice. I go away, what to do?
Okay, what three stressors are we looking at? Physical,
Emotional.
chemical, and emotional.
Yeah.
You're talking about chemical, okay? What else do you got for me? Did you get a structure checked? Or your structure checked? Did you look at the pelvis to see if it's unstable? Okay, or you, whatever. I don't know. I'm going back and forth. It's like a tennis match, okay? No, but think of this, because truly, if you look at that, because your head is forward, it's off to the side a little bit. There was some kind of neck trauma in the past, so that's a given, okay? But if you sit down during the day, okay, a lot, that's going to be an unstable pelvis. Okay, so you got an unstable pelvis. What's housed in the pelvis area? You're talking the parasympathetic activity. Okay, so now if you got a neck problem and a pelvis issue, forget that. You're in a sympathetic dominant state. Okay, so I don't care. You give the fire juggling, knife swallowing air traffic controller guy, okay, who's majorly stressed, okay, and give him a healthy diet. How does he work out? No. You got to fix all three. You fix all three and you change the world around.
One more question. How to avoid vaccination, forced vaccination for education? Are there any doctors that you go to?
There are real doctors that are still out there, okay, and they're having their licenses, they're being pulled up before the boards, because remember, this isn't medical, it's not science. No one in the world would say 69 doses or 72 doses of 17 different vaccines randomly without any recourse of any side effects is going to be forced on the public, and people go with, oh, I'm sorry, I'm describing America. Okay, so you understand that's insane.
Yeah.
So there's some doctors out there that are doing homeopathic prophylactic vaccines, and those are safe. Okay, other doctors are saying no. You know, just because there's aluminum in them, and the National Institute of Health says any aluminum-containing vaccine can cause a negative response, particularly if you have, you know, the MTHFR gene. There's about 9 different genes that some doctors will accept and say, bam, you can't handle the toxins the way an average person can. However, the average person has one of those gene abnormalities. So the only way you can do it is we'll give you the paperwork, you get a 23andMe test, find a doctor, but honest to goodness, vote. Call up the congressman, because ultimately the only reason we got this stuff forced on us is because we went along. So we have to start calling up the senators and congressmen, and if they say they're safe and effective, really look at our data. Look at every day. Do you want polio coming back? Yeah. 98% of everybody recovered from it, and the polio vaccine that you and me got, okay, that raised our rates of leukemia and brain cancer 1,000-fold. Okay, but they only found that out 30 years after we got that sweet little sugar cube. Okay, you know what I mean? So no, we take it back now. Call up certain doctors. We got a list of some doctors, but they're falling off of that list pretty quick because, I mean, it's their livelihood. And there are some doctors that are going to take a stand, but, you know, if you're getting your license pulled and you've got a mortgage and house and everything else, you know, I mean, Senator Pan's got enough money to fund this stuff, but he's getting that because he's a shill and sold his ethics and morals. I mean, you know. Yeah, maybe he didn't. Maybe he never had them in the first place. Yes, sir.
I want to go that air traffic controller thing you just talked about.
Mm-hmm.
Let's say let's say, I don't talk about my own life, but let's say you have this stress that's that's what you do. So if that's, should you switch jobs, or should you change the way you deal?
Oh, cool. Oh, this is cool. Okay. Let's say that you had a son that likes to twirl flaming sticks, flip flaming things, like driving in fast cars, almost broke his neck, and totally digs kiteboarding, skydiving. Yeah. Okay. I'm just saying, you know, broad-based stuff. Okay, hypothetically, yeah. Okay, that's an adrenaline junkie. Okay, they really like doing it, but if they do it with thought, that's not a stressor. Okay, it's an enjoyment. Okay, so it's really healthy stress. Without stress, we all die. Without stress, our bones would just be jelly. I mean, even people that are dead, they got stress. The bacteria's eating them up, okay? Or unless they're preserved, you know, in something. So it's not stress that's bad. It's stress that's not handled correctly. And that's going to be the physical, chemical, and emotional stress. So you can eat that occasional donut, okay, if you have a fantastic organic plant-based diet. Now the donut nowadays is soaked in glyphosate. It's not the donut we had back in, you know, the 60s. Okay, this thing is poisonous glyphosates, which will mineral chelate your body and destroy the gut bacteria, and genetically modified beet sugar, which again is completely toxic to your system. So the donut today is not anything that we would resemble, but you could have that bit of poison and survive if you have less stress in your diet. You know what I mean? If you have physical stress, where you're a truck driver, you're an airline pilot, and you got to be sitting in that seat forever, we have certain exercises that you could do while you're in that seat. Let's say you're an office worker, an accountant. You know, there's certain things you can do to handle that physical stress. Do you have to get up every hour and walk 5 minutes? Absolutely, that'd be ideal. I don't know if pilots can do that. I got to ask them, because we got a bunch of pilots has our patients. Yeah, you know, what do? You know, you don't have a bucket up there. Okay, so you know, so you look at, what about the emotional stress? Can you handle dealing with people that are sick, dying, stressed, doing, you know, I mean, every emotion where some people are saying, oh my God, I no longer have cancer, my melanoma, my blood tests are clear. Holy moly, my son just got brain cancer. Okay, oh my gosh, my uncle just did the chemotherapy and he died. Oh my gosh, my daughter who could never get pregnant got pregnant. Can you imagine dealing with that stuff like 12 hours a day? Well, anyway, that's me. So you handle stressors like that by doing something else, visualizing, because when I'm working on somebody, I'm not working on a sick person. Everybody's 100% healthy. They really are. It's just there's something blocking that expression of life. So I don't look at sick people, they're just healthy. They're just been in a tough environment. My job's to change that autonomic response. It's like we had this one kid, microcephaly, she's this big. She was born blind and deaf, supposedly, except you do this and she jumps, so she's not deaf. Okay, she's starting to react to light, so she's not blind, okay? But what's her potential? Don't know. I'm not in the judgment business. In my world, she's got 100% potential. 100%. Okay, so if I approach her with anything less than that, that means that I'm prejudicing my results as well as the infinite wisdom of the body. So, anybody. So, you deal with emotional stress how best you can. And there's certain ways to do it. Emotional stress, there's the DeMartini breakthrough method, there's nonviolent communication by Dr. Marshall Rosenberg, there's getting your butt out on a sailboat, which, damn, that works for me. Okay, but chemical stress, healthy diet, okay? Healthy diet, plant-based, organic, locally sourced, seasonal, normal with supplementations minimal to counteract for the loss of healthy soils. And then physical stress. Look at your body, get your nervous system checked and stabilize it and make it work correctly.
That was going to be my first question.
Okay.
If someone's dealing with physical, chemical, and emotional, and it's difficult.
Microphone
and
up.
it's difficult, they're dealing with the physical, chemical, and emotional concerns, and it's stressful. Then when they come around you, and you bring up all the horrors in the community of vaccines and world, I was going to say, how do you deal with it? And so you answered my first question by your last response.
Cool.
What I was wondering.
Should I get a chair while you ask this? Okay, what?
Hearing all those things you were,
What, darling?
children and the vaccines and,
Sweetheart, what's your question?
okay, as far as floaters in the eyes, is there anything to do with that?
Oh, good. Boy, that was easy. Okay, remember, I only got 50 minutes to do this. Okay, floaters in the eyes. You're talking the vitreous humor inside of the eyeball. It's a filtrate. It's always being produced and eliminated, produced and eliminated. So start changing the diet, making sure that production gets up, but it's also look at how the body is making stuff. And this goes on with wrinkles. If you have low stomach acid, you're not going to be producing healthy proteins. Okay, you're not going to be breaking the amino acids or the proteins to amino acids, so you have a poor building block. So nutrient deficiencies can be that, and stress can cause that. Okay.
Okay, I have a couple questions on platelets, how to raise platelet levels, and then also how to lower really high ones. So I guess it's 2 parts.
Okay, this is good. So how to raise and lower platelet levels. Okay, to lower them, all you got to do is cut an artery and you'll bleed out. You'll have no platelets. It'll happen very quickly. Death will result quickly after that. No, but I mean, humans are self-regulating and self-healing. That means they regulate themselves and heal themselves. Platelets are involved in clotting factors. So you're looking at a large platelet production that there's a problem. Okay, there's tissue damage, and that's going to develop it. Or there could be a problem with the spleen, because the spleen goes in there and checks every red blood cell. And every time there's a blood cell that's too old, because they only last about 120 days, it sends that constituent over to the liver to be broken down into bile. So there's a regulatory mechanism where these cells are produced or stimulated by erythropoietin produced by the kidneys. That's the red blood cells. But you're looking at an immune system response. And this is going to sound weird. You've got to look at the physical, chemical, and emotional stressors that's causing it. Okay, chemical stressors that can cause this are vaccines. And they even say it on there. You know, thrombocytopenia, problems with cell production. You're seeing all of this stuff with an immune system response that's gone haywire. haywire. And then when you look at communication, you got the nervous system and the endocrine system. So is there a problem with endocrine disruptors that they've been exposed to that's going to limit the function of the kidneys and the spleen and the liver function, okay, which also takes care of this. But then ultimately, since the platelets are there and they're used for tissue repair, what's causing the tissue damage? And that's the key. So it's not I want to raise it or lower it. That goes back to the naturopaths or the holistic medical doctors who are saying, hey, look, take this iodine. This is good for a thyroid. Oh, this supplement here is amazing for B12. It's incredible. Crohn's disease, no problem. I'm going to get you some magnesium, my friend. Instead of saying, well, wait a second. Where did the deficiencies come from in the first place? Was it really magnesium deficiency that caused it? Well, where did you get your magnesium from? Was it from a poor toxic diet? Yeah, possibly. Okay, where did the tissue damage to cause the increased platelet cell come from? Was it toxins in the vaccines? Was it toxins in the food? Or was it a physical trauma that they had that was never repaired? Does that make sense? So no more allopathic stuff. We call it allopathetic. You got a symptom, here's a substance. No.
Oh, and then was that also how to raise?
Raise and lower it, okay? Because each one is going to be an immune system response, and you have to look at what the problem is. So when you look at your body, because if you have low platelets, your body is responding correctly given that environment. Okay, so that means that the low platelets means that you've got a poor production of cells. So you got to look at the underlying factors. How are they sleeping at night? What's the nutrition like? Are they doing an organic plant-based diet? What's their history like? Did they take a bunch of antibiotics that blew holes in their intestinal tract so now they don't have the absorption of it? Do they have poor sleep patterns, or they had multiple medications before that damaged their body's ability to produce stomach acid so they can't absorb it? Did they have part of the intestinal tract removed? Which you've seen that before. Gastric bypass surgery, boy, that's a genius operation. Okay, you're guaranteed to die early. I mean, it's insane. So find the physical, chemical, and emotional stressors, and the body will respond. If they've had parts missing that's causing this response, then you really have to have a thorough assessment of all the three stressors. Because like if your bladder was, damaged when you were 6 months old and they replaced it, you're going to have to deal with certain deficiencies. Like if you've had your thyroid removed because the person found a nodule and they freaked you out, you're going to have to take Armour Thyroid or Nature's Thyroid the rest of your life. Yeah.
Male pattern baldness, would you say it's still a part inherited, or is it deficiency and stress because the androids are high, right?
Male pattern baldness, there is a hereditary factor, but also a nutrition factor. Okay, so it's elevations in testosterone, and so people can be predisposed to having stronger, healthier bodies. But
so what would you do if you're a young guy and you see it coming and your father had?
I honestly embrace what you got, I mean, you know what they say, God made a few perfect heads, the rest he covered with hair. God knows what it looks like underneath this. I mean, I'm afraid to look. Okay, if you got it thin, it's weird because you hear that this is our skin suit. To be hung up on whether you got hair or you don't have hair, I mean, it makes a difference if you think that that's important. But we're all the same inside. I mean, and it's kind of cool that the fact that we were having a discussion on diversity, and I'm looking at it, I'm thinking, well, what's that? Because we have every race. We had a month ago, we had a Jewish guy who's a Hasidic Jew with the curls and the black hat, talking to this gal in a full-on burqa from Saudi. And then I was working on this gal from Israel, and she said, you'd never see that. Never in Israel. They would go out on the other side of the street. And I thought, yeah, but they're really cool. I mean, I know them both. I mean, I've been working on them both for like a month. I mean, they have the same belief system. You know, I mean, a different methods to worship, but they are worshiping one God. And they were having a really pleasant discussion. So being hung up on vanity, that's a personal thing. But to stop the baldness, I don't know. But you know, it's kind of like goes on the veins of should you get breast implants or not. I mean, the breast implants are going to be a foreign object that can have a negative effect, but if it helps you with your self-worth, then fantastic. So you get hair implants. If that's a big deal, it'll help self-worth. Or a supplement. A supplement, yeah. Yeah, I don't know. I mean, you know, again, bald, I think of Sean Connery. So, you know, I mean, there's nobody tougher than that.
Questions. I have a question about tonsils.
About what?
Tonsils.
Oh.
What role does that play in your emotional, chemical, and stress?
Oh, the fact that they took mine and offered me ice cream when I was a little kid and it tasted like blood, and that it's lymph tissue and vital to your immune system and can suppress infections and sinuses and allergies and lung function. The fact that it was a super big fad that nobody even talked about milking the tonsils, which is what we do. If you get a swollen tonsil, you go in there, you squeeze the pus out of it and get somebody on vitamin A, vitamin C, vitamin D. The tonsils swelling not only goes away, but the immune system's stronger. So what I do is if I see anybody in my age, which is from like, you know, 40 to 65, in that age group, you know, how did you get out of that tonsil fad? Because everybody was ripping them out, you know, and I said, yeah, buddy, we paid for a lot of Cadillacs with those tonsils. You know, it's just insane. You're not blessed with a bunch of extra parts. You know, God didn't screw up by building you, or if you don't believe that, evolution didn't just, God, you got these things at the end of your throat that swell up for no reason and cause you discomfort. That's insane. We had a guy that got his appendix taken out, and he asked the surgeon, it was actually the son of one of our patients, he asked the surgeon, he says, what does the appendix do? It's nothing, it's back when we had tails. Well, for one, we never had tails, okay? But the worst part of that is, what animal has a piece of their intestinal tract in the tail? I'm not a zoologist, but I would really like to find out if somebody poops through their tail. But the appendix is actually a reservoir for bacteria that's designed to be in the intestinal tract. So if you run through diarrhea, it can repopulate that intestinal tract. And if you've had your appendix removed, you got a 60% increased risk of colon cancer because you can't repopulate the system. So the tonsils, vital for lung function, vital for everything else. And luckily, they can grow back, okay, if the surgeon left a little bit there. So we've had a lot of people that said, oh yeah, they had it gone, but they got a sore throat. And I go, they ain't gone now, buddy. They're there. Yeah, so it's, you know, your body's good.
Okay, there was also a question about coconut oil. Did you read that study where the university professor said that it is deadly?
Yeah.
How do you feel about coconut oil?
Yeah, coconut oil. There's a number of people with agendas out there on nutrition. And when you look at healthy saturated fats, it's one of the most essential nutrients for brain function. There's a number of studies that show that coconut oil helps reverse Alzheimer's and dementia. It's absolutely vital function in a lot of different physiologies. If you are sensitive to certain oils, okay, it can be a challenge, okay, but that's with all oils. But you need fats. You need healthy fats in order to produce hormones. So to say that coconut oil is deadly, I think that's a stretch. It might be headline grabbing because it just doesn't make sense. But when you have volumes of data on one side that say not only is coconut oil safe, effective, fantastic, great for brain function, great for the immune system, and then you have the old style data, which was Ansel Keys back in the 70s, that totally fudged the data, and he said, trans fats are the way to go. Saturated fats are dangerous. Vegetable oils are the best. Well, now you look at vegetable oils and trans fats, you're going, are you serious? Canola oil? Okay, soy oil? That's poisonous. It's inflammatory. It's the processing of it is completely toxic to the body. So, I'd suspect that he's got some kind of agenda. And I'm looking at the data and looking at how human beings work. Now, coconut oil, it's been around for a few thousand years. And, we can go look at people that have utilized coconut oil as their primary source of fat. They're called Polynesians. Okay, good looking, healthy race, I'd like to look like a Polynesian.
I'm going, can I take?
Sure.
Oh, yes. Well, so when we screw up with the 3 main things that we need to do, and we wake up and we find out we're reacting to that bad behavior for a few days, is there a quick fix?
Okay. Yes, there is. There is. Okay, so the 3 behaviors you're talking about are physical, chemical, and emotional stress. Those are the only 3, by the way. There's not like more. You can put everything in those 3 categories, okay? Yeah, so let's say you've got excessive stressors. Like you're working for a project, you got to stay up 2 nights in a row, you get the project completed, your sweetheart says, honey, come to bed. I am busy. So then you got the emotional stress as well as the physical stress. Okay, so you got all of this stuff built up, and then are you eating good on this? No, you're eating the cold pizza that your son brought. Okay, so now you got 4 for 4, right? 3 for 3. Yeah. So you'll recover. I mean, human beings do, and that's the cool part. Get back, like if you're missing a couple of nights of sleep, because when we're going on long trips, you sleep in 4-hour increments, and that's not enough to have healthy sleep. But you get through it. It may take a couple of days to get it done. You may have to stay out late at a party. Beautiful. Increase your omega-3s because that's going to be good for your stress hormones. Get a little bit more water, a little bit more minerals. Let's say you're going out with friends and you're going to drink. Okay, drink less. I know that's not an option. Okay, but look at like coconut water that you can get in there to replace the electrolytes. Okay, get smaller glasses so this way you feel like you're drinking more, and then drink more water and go to bed early. I mean, there's a lot of things you can do, but everyone's going to have stressors, and just deal effectively with each one as they come along. But if you have patterns, if you have habits that let's say you do neurolinguistic programming every morning. Let's say, you're up at 4 in the car at 4:30 and you sit there and you go, I am healthy, I'm dynamic, I am vibrant. And you do that for 10 minutes. I live in a world of abundance, and you put this out in the universe and you program your brain for 15 minutes in the morning before you get to work. What's your emotional status like that, right after that exercise? Good or good? I said good or good. And you say awesome. Always one-up it. Those Canadians, okay, but yeah, you can see it like that, okay? So and then what do you do if you're in Chicago and you eat a Dunkin' Donut? Okay, I did that last year. And it looked so good, it tasted so crunchy, and I felt kind of sick for a couple of hours afterwards, and then we got a juice afterward. But I got to tell you, the apple fritter that I remember in my brain doesn't exist anymore. Okay, it just doesn't. So I lost the thrill about a year and a half ago.
But I woke up after a 2 or 3 day stress siege, eating cookies because I was too busy to blah, blah, blah. Trying to remember to drink some water, but I woke up and everybody said to me, did you go to the doctor? I said, or to the hospital, because earlier today it looked really bad. And I said, what are they going to do to correct what I just did?
Okay, now you were suffering from severe self-responsibility. Okay? Now, if you were the standard American, you would go, I'm sick, fix me. And the doctor, for sure, has anyone gone in here to a medical doctor and the doctor says, gee, you're in here with stress and anxiety. How are you sleeping? How are you eating? What kind of things do you do that are enjoyable? What's your life like? Are you happy right now? What are you doing? You know, to ask like real pertinent questions. How many bowel movements a day are you getting? All of those would have to do with your physical, chemical, or emotional stress load. But you're not looking at that. You're looking to solve it yourself. I know, that's brilliant, because that's what we ultimately are. We're responsible for ourselves. And your body will be fine. Yeah.
And my eye.
I will heal. Everything heals. Everything
The
that.
white stuff that was coming out of it felt like it was all white was in there. Am I having a stroke, or is my eye gonna fall out?
Well, then you get to your chiropractor, you talk to him, you say, hey, look, okay, a good example. We had a patient, she's like 53 years old, very depressed. Her daughter got pregnant, okay, for the second time, and she was like 20, and she's feeling like a failure as a mother. You know, I mean, anybody feel like a failure in their life? Anybody? Why, no, not you, but anybody else. Okay, so when you look at this, she was really sad. So she ate ice cream every day, breakfast, lunch, and dinner. And okay, honest to goodness, I know, I got the same smile. The 12-year-old comes alive in you and you think, God, how cool. Okay, but then after week 1, week 2, week 3, she started to develop, her gums were bleeding, okay? She started to bruise easy. She couldn't sleep well. Her pooping started to stop. It was just runny stools. She felt anxiety, stress, and depression. And guess what? The medical world came through and gave her some Prozac and Wellbutrin and Depakote. Okay, and I go in and I go there, and I see her after about a month of doing this, and I go, Jesus, what happened to you? And so I said, hon, you got scurvy. I mean, scurvy is what the military and sailors used to get because of very, very poor nutrition. So we could have given her a muscle relaxant, a pain reliever, an anti-inflammatory, and the 2 or 3 antidepressants, or got her on vitamin C, fresh organic juices, and explained to her that your body's responding because you're poisoned. Okay, one more question. Well, what time is it now?
We have like 3 minutes.
Okay, good. One more short question now.
Kind of frightened me with that, with the appendix things. I had my appendix out when I was like 20.
Oh.
It got inflamed, and the doctor just cut it out and he said, "You don't need it. Don't worry about it." So, should I be worrying about it now that I'm 51 years old?
Yes, I would totally worry about it. Then that will be with this physical, emotional stress. No, I mean, if this is kind of cool, because what does the appendix do? If you're missing it, do what the appendix would anyway. Okay, so the appendix repopulates your intestinal tract after a massive evacuation because you need bacteria in that intestinal tract to produce vitamins. It's vital for your immune system. It breaks down nutrients so you can get absorption. It's amazing. So you're going to have to eat fermented foods with every day. I mean, with every meal would be really cool, but every day. And that's going to strengthen your immune system and take over the job of the appendix. It's like, what do you do if you've had your thyroid removed? You got to get a pig, grind his thyroid up and put it in your mouth, or get Arma thyroid or Nature's thyroid. Okay? It doesn't matter. Just start. Tonsils, let's say you had the sugar cube 35 years ago and brain cancers and tumors, eat a healthy lifestyle, lead a healthy lifestyle, and you do the best you can. I mean, what are you going to do knowing that the dollar's going to be worthless and the volcanoes are going to blow up and everything? Nothing. You plan, live like there's no tomorrow, or love the people you're with and, hope for the best and plan for the worst. Makes more sense? It does to me. That way you're not freaked out about it. Okay, one more question.
I was just going to ask you, I don't take medication. I stopped eating sugar at 12. I was brought up in Mediterranean with Mediterranean diet. Am I doing good?
Don't know. If you're Greek, if you're from, well, remember, because this is like going around everywhere. If you're from Greece, economically, you're not doing good. Okay, physically your diet is pretty good. I mean, everything you're doing. But again, what is that? You just described a lifestyle of healthy food, seasonal, plant-based, normal. Yeah, so that's beautiful. Well, I mean, human beings aren't designed to take medication.
All my organs are intact.
Okay, human beings are not designed to take medication. So you're telling me that you have a healthy diet, plant-based, organic, Mediterranean, beautiful. Then you look at the physical stress. Okay, that's where we get the x-rays. Then you look at the emotional stress. I mean, do you know what a burden, well, you would. What a burden it is to be blonde and beautiful your whole life? Yeah, I know, that sucks. No, but you understand, okay? Yeah, so that's a good lifestyle. Okay.
Thank you so much.
Now, did everybody like this format? Yeah? Okay, good, because we might do it next week, but I think I might have to do a talk, because there's a couple of subjects that are coming up. So thank you very much.